Wait, let me break it down. Pelvic organ prolapse. I have no idea, but it sounds absolutely terrifying.
It's like when it's like falls out.
It's when the good stuff starts losing its elasticity in its muscular wall, and it bears down on the pelvic floor, and in very extreme cases could actually protrude through the vaginal wall.
So imagine that you have 10 kids jumping on a very small trampoline that's already weak to begin with. Probably those kids are going to fall through. This is an analogy for a pelvic organ prolapse. The 10 kids are synonymous to the weight of your body and the pressure that you might exert from things like coughing and exercising. And the trampoline itself is like your pelvic floor structures, your muscles, your ligaments, your fascia, and your connective tissue. There are a couple different kinds of pelvic organ prolapse. For females in particular, the bladder, the urethra, the vaginal wall, the uterus, the rectum, or the small intestine can descend down. For men, it's not as common, but their rectum can descend down. For males, the external genitalia provide a lot more support for their organs, so they're able to hold up easier. There are also different degrees of pelvic organ prolapse, from 0 to 4. 0 meaning there are no symptoms, and 4 meaning that the organ has completely descended outside of you. If you have degrees 1, 2, or 3, it's important to see a pelvic floor physical therapist so they can help you get set up with pelvic floor strengthening exercises, teach you really good body mechanics and breathing techniques, and help you manage your symptoms. If you have a grade 4 prolapse, more likely than not, you'll be getting surgery, but it's still important to see a pelvic floor physical therapist who will help you with preoperative strengthening.
Okay, so we'll start with pelvic floor prolapse and urinary incontinence sort of go hand in hand. But I think that the pelvic floor is an evolving part of our bodies, right? It changes with time. It changes with age, with experiences, with sexual activity, with delivery, hormonal changes, health issues, weight. So it's an evolving part of our bodies. And as an evolving part of our bodies, it changes over time. And so we will see that over the course of our aging, we'll notice changes in the vagina, which is mostly where the pelvic floor is affected. And most of the stuff doesn't need to be addressed. The issues that are concerning are when things are really dropping and there's this feeling of just pressure and all your organs are falling out. About 10% of women will have enough of a prolapse in their menopausal and postmenopausal years that they'll need to have it addressed. So that is not a big number. And when I say addressed, meaning going to a doctor, finding out what it means, doing exercises, surgery, which is the ultimate treatment for pelvic floor prolapse, is not a common operation. We do about 250,000 surgeries a year in a country of 350 million people. So we're not talking about a problem that most women are going to wind up having to have surgery for. So it's more an issue of learning what your pelvic floor is doing at what point in your life and how you can maximize the effects and your comfort. And that's my focus. That's what I spend a lot of time talking to patients about.
I would imagine it's painful, or that there's issues with, your bodily functions. That might be the first sign, is like something irregular about your poop or your pee or your period, even pain. When I think of prolapse, I think of pain.
Distress in the lower regions.
Putting your hand down there and feeling something that should not be there would be probably my first clue.
I'm sure it would hurt like a...
One of the most common symptoms of a pelvic organ prolapse is pressure or a sensation of dullness around the vaginal area. People often find that they're also experiencing urinary or fecal incontinence and have difficulty going to the bathroom. The other thing, that's cherry on top, is low back pain. Oftentimes, people will find that these symptoms happen more towards the end of the day when they've experienced a lot of pressure from gravity, from walking around, going up and down stairs. So laying flat usually helps a lot. Sometimes even going slightly inverted where your hips are higher than your chest can be really helpful. So a bridge pose is something you can try.
But I think it's confusing. Who do you see? If you're a woman and you delivered and you're now 2 or 3 years postpartum and you go to your gynecologist and you say, I'm having issues with incontinence, or I feel like my vagina is falling and it feels heavy, who do I go to, right? And the gynecologist may say, I think you're fine, but you want to know from somebody who knows this area whether it's fine or not. And there's an entire field that's dedicated to this called urogynecology. And urogynecology is either as a urogynecologist, you can be a urologist with a specialty in gynecology or a gynecologist with a specialty in urology. Doesn't matter. A urogynecologist is who you want to go to. And every community has them. Some are male, some are female, but their specialty, regardless of their gender, is this area of pelvic floor issues, including urinary incontinence. And that's who you would want to see.
Age and activity.
Yeah, the first thing that came to mind was just something just get like unstuck and then it sort of falls. But I don't think that like our bodies are made of Velcro.
I'm sure giving birth would have something to do with it because you're pushing something the size of a watermelon out of the size of a lemon. So I'm sure that doesn't do great things to your vagina. Could sex do it? Who knows?
Either maybe you have like IBS or like constipation. Once again, childbirth, anything where your body is doing a lot of pushing down there. I've even wondered, I feel like I may have heard something about it happening to like athletes from like doing too many like exercises in their abs or like just sort of overworking that area past the point of like exhaustion. I don't know if you could physically like push your own shit out. But that would be pretty crazy.
There are a couple of different reasons that you might have a pelvic organ prolapse. If we go back to our trampoline analogy, if those kids are too heavy or the trampoline is too weak, that's when a prolapse happens. When we lift heavy objects, we should never hold our breath. Sometimes, when a movement is difficult, people tend to do this. This is terrible for your pelvic floor. Why? It's basically like dropping a bowling ball into our pelvis every time we do that. We need to be breathing correctly during movements. Exhaling in a controlled way as we contract our deep core and pelvic floor muscles during powerful movements is a great start. Constipation. Many of you have sat on the toilet and held your breath to push out a bowel movement, right? Similar to the point mentioned before, holding your breath and pushing hard during a bowel movement is also going to add excessive pressure to your pelvic floor and cause undue stress. Pulmonary disease. There's a correlation between prolapse and chronic obstructive pulmonary diseases like asthma and chronic bronchitis. This is because coughing excessively throughout life increases intra-abdominal pressure or the pressure that your abdomen exerts down onto your pelvis. Obesity. If you have more weight above your pelvic floor, this can lengthen and weaken the pelvic floor as well. It's also possible to have compromised pelvic floor tissues, connective tissue dysfunction, and hypermobility. Many systematic diseases can impact the laxity of the tissues in your body and cause collagen weakness. When the tissues stretch excessively, there's less support to hold up the organs. Also, women with benign joint hypermobility tend to have more prolapse. Previous surgery. A history of hysterectomy, for example, can predispose you to future prolapse. This is because the surgery itself can compromise the integrity of the tissues in and around the pelvis. Pregnancy. Normal childbirth is a trauma to the pelvic floor.
What about age? I see a lot of patients that are over 35. I know one of the things we see in the literature, and I would want to ask if you see this as well, is does being an older mom, or particularly an older first-time mom, which is something that I see a lot, how does that impact the pelvic floor in your experience?
Yes, a good question. Age, maternal age, and the birth of the weight of the child and the weight of the mother and genetics are the biggest factors. So the literature does bear out that older first-time mothers are at a higher risk of developing pelvic floor issues as they age. But again, I wouldn't discourage vaginal delivery for that reason, because plenty of women have children at an older age and don't have issues.
probably what I would say is it's even more important to do the perineal massage and the postpartum pelvic therapy. Like those moms in particular need to be sure to, watch these videos and learn from this to take that extra care.
Exactly. I mean, it's the pelvic floor is part of our bodies, right? So it's all about health overall in every part of our lives. So it's nutrition, like Dr. Worth said, it's nutrition and it's exercise and it's maintaining your weight, all of which are harder if you're older. And so an older mother, first-time mother in particular, is going to have to work maybe a little bit harder to do those things than if you're 22. So it's really about prevention and self-care. And also having a good attitude, feeling good, feeling, positive about the experience of your birth.
Kegels again can help. I don't know. I think it depends on how bad it is, probably, and not how bad, but on how much the organs have descended.
Or some kind of like operation to like put it back in.
If I haven't heard of it, I have not heard of the treatments for it.
I think it's really important that everybody that women get advice from professionals, that they not catastrophize. This is not life-threatening. These are all quality of life issues. There's a lot of help out there. And just to recognize that don't be ashamed. Talk about it. Talk to your doctors about it. Talk to professionals and get the help you need. It's out there. And enjoy your body, enjoy your life. There's no reason for you to be hiding anything about yourself.
So here are a couple of tips that I give to my patients who have a prolapse. Firstly, strengthen your pelvic floor. And if you can, do it before you give birth, because once the baby comes, you're not going to have as much time. The second thing is the use of a pessary. Pessaries are basically little objects that you can insert vaginally, and they help keep the organs up. The last thing is reducing body mass. So activities like running and jumping are probably not recommended, but swimming and biking are great.
My perspective is, take good care of yourself during the pregnancy. Good nutrition, activity, perineal massage, chiropractors. I have lots of strategies to help women have the healthiest possible birth, whether that's a vaginal birth or a surgical birth. And then after the birth, prompt assessment of the pelvic floor.
There are two reasons why it's so important to understand the sort of dynamics of the pelvic floor and how to do the exercises. One is to understand your pelvic floor because it will change over time. So you want to have a sense of what you're feeling and have an experience with what you're feeling. You got to know your body parts. And number two is to help strengthen those muscles so that they can continue to support your body as you age, because that's the reason we have a pelvic floor, is to hold up our pelvic organs and to hold our bodies up. It's part of what keeps our bodies upright and erect. So as you weaken, everything starts to descend. And these are things that you have to be aware of as you age. So physical therapy postpartum is like an absolute, and it's unfortunate that it's not sort of part of what the delivery entails.
Prolapse sounds like a scary word, but it doesn't have to be. Pelvic floor PTs can help you. And if you don't have a prolapse, then treat everything you heard today as preventative strategies.